Welcome to the Power of One. Today, we are going to have a very heavy conversation. We are going to be speaking with Carolina, and we are going to speak about mental health and we're going to speak about suicides. This is so important for you to pay attention, and then we will have resources at the end of the show for you. Welcome to the show, Carolina.
Thank you for having me here.
Carolina, please tell the viewers your title and exactly what that means.
So my name is Carolina Hausmann-Stabile. I'm the Director of Population Health within the System Integration Unit at the Department of Behavioral Health and Intellectual Disability. Those are a lot of words to say that within the Department of Behavioral Health in the city of Philadelphia, I direct a team dedicated to population health. So we want to help foster the well-being and the mental health of all Philadelphians. We are more on the side of preventing mental illness and assisting those who have mental illnesses to prevent deterioration.
Mental illness shows up in many, many different ways. And sometimes it doesn't seem like there are services for those who suffer from a mental illness. And I'm going to speak about something personal for me just for a second. I know of someone who's suffering from a mental illness. They wreak havoc in the neighborhood, but their family is not seeking services. So it kind of ties the hands of the people in the community, but it's hard for the people in the community to hear all of the things that are being said out of this individual's mouths. How does neighbors get past that or help that individual?
So mental illness, as you say, Melanie, is so complex and manifests in a range of behaviors. Sometimes mental illness can present as disruptive behaviors. So we might see somebody whose behavior, for instance, in the community might be agitated. They might be listening to things that we cannot listen because they are not there, and they are responding to it. And this can be caused by psychotic disorders, so chronic, severe mental illness that is genetic in form, and we don't understand why it happens, but it has a strong genetic component. Or it can be happening because they are high on something. For instance, in an LSD or an hallucinogen. So there are different reasons why people, or they can have later stages of alcohol dependence, or they can be demented. So the same behavior, being agitated in the street, might cause different situations, or might be caused by different paths or illnesses of disorders. Now, if we are neighbors and we are seeing neglect, is that if it's an elderly person that we can suspect that they were doing well and now they are doing very poorly, we can think of one of those age-related behavior changes that can be dementia related or can be related to changes in medication. Sometimes it has to do with diabetes and changes in blood sugar. So if the family is neglecting the medical care and the medical needs of such an individual, we as neighbors can call 988.
Mhm.
If the individual is in the street and is at risk because of their behavior, or is putting perhaps others at risk because of their behavior. So 988 is one of the best resources we have in the city for psychiatric crisis, so mental health crisis that might happen in the community. It could be that there is a loved one that we are very concerned, and it's a crisis. So when we talk about mental illness crises, we tend to think of situations in which the individual well-being is at risk, or somebody within their network or their community is at risk because of how they are behaving. Okay, so our first line is called, if we are seeing a crisis, is 988. The second line of intervention is we are not present in a crisis, is to call 311. The city has services that you can call and explain the situation, and they will connect you to paths and connection, give you ideas of where you can reach out for specialized care. In the United States, it's true, reaching out services can be hard. And in part of it is because oppressed communities were often abused in the name of mental health. So were they confined or were limited in the treatment. So we are very careful of how we preserve the balance between the freedom of an individual to take choices around their health, including their mental health, and the risk that their behavior is causing on themselves and on others. We tend to embrace more their freedom and keep our hands off. But if we see anybody that we suspect is at risk, or we are sensing that we cannot maintain our functioning, we can call 988 as the first line of intervention.
Now, with that 988, does that entail someone being 302? And if they're 302, tell me if I'm incorrect. They will be 302 for 72 hours. They can actually sign themselves out. And if they ask who 302 them by law, that information has to be disclosed.
Okay, the good thing about 988 is that when you call 988 for yourself or for others, you're going to talk with a clinician who is trained to do crisis management. Unfortunately, 80% or approximately 80% of the calls the situation is resolved during the phone call. So it doesn't involve 302s. Only a small percentage of situations require the involvement of what we call mobile crisis, when the situation is in a level that cannot be de-escalated through the intervention in the phone or referral to outpatient services, and the person is not in a position to make decisions about their well-being and care because of their mental status. So it's an extreme decision in which for 72 hours, we suspend the person's ability to make decisions about their medical care based on the altered state, okay? It's kind of an extreme if we think of the spectrum of care, 302s are at the extreme, and 302s really save lives. They have a kind of like a bad rep, but they save life because they're only done and they're under lots of legal and medical considerations when really it needs to be done. It could be a person that needs to be detoxed. Or a person that has destabilization because of stopping taking certain drugs that might cause them to die. So you stabilize them psychiatrically, and then through continuity of care, you can link them to other services based on their needs.
Okay. Now, in looking at the website for Healthy Minds, I saw specific tabs, which I thought was amazing. So there was support groups, there's Black therapists, it was LGBTQIA plus resources, which is great, grief resources, which is amazing, and youth resources. That made me feel so good because one, within the African American community, and I will speak personally, I do know that sometimes most of us are very skeptical about who we say, okay, they're going to come in and then they're going to save us and then they're going to leave. They're not like us, and how are they going to help us? And listen to our problems and truly understand what we're going through. So I thought that was very unique and strategic to have all of these work groups. Speak on those a little bit.
So thank you so much for going and checking Healthy Minds Philly. Healthy Minds Philly is a baby program in the department. Is a prevention program and connecting with services. It's a phenomenal website where not only the things you listed are available, and many of them are free, but you also get connected during business hours with a chat line for free where you talk to a trained peer specialist if you have questions about mental health, if you want to understand. So you can call member services and CBH member services. If you have Medicaid and you want to start addressing mental health issues. But also you can go into this website and go get help and check the chat line, and you're going to be not with a computer, not with artificial intelligence, chatting with a human being who can call you on the phone and direct you about how to best get services. When do we have anxiety? What is depression? If my
Mm,
child is, behaving in a way that is concerning, what can I do? So, and we have an array of things that we understand. And let me tell you, Melanie, I'm a Latina. I understand exactly what you're saying. If I go to a clinic for mental health, for my depression, my anxiety, I want to be with somebody who understands my culture, who
mhm,
understands the
mhm.
role of the family and the
Yes.
community, who values what in my culture we do to help each other, not to
Mhm,
think that that's weird. So we have a tab connecting you with services for different communities who might share that need. For instance, we have a list of Black therapists that take any array of insurance and any array of fees. So these are people who are taking patients, many of them. Then we have providers for the LGBTQ plus community
mhm,
that are attuned to their specific needs. We have an array of other services. You can take screeners if you're not sure if you're depressed or if you're anxious or maybe you're drinking a little bit too much or you're concerned about gambling addiction. You can go and take an educational screener and make an informed decision about the next step in your path to well-being. So we invite everybody to go and visit Healthy Minds Philly for more resources. Explore blogs about recovery, about well-being. We have sheets, where we can check out what is happening with our drinking, with our substance abuse, when things are getting a little bit harder to handle. What is the next step in our road to feeling better?
That's awesome. That's awesome. Now, tell me what role your office plays in suicide prevention.
Well, suicide is a big concern in public health. Fortunately, I have good news. In Philadelphia, we are doing pretty good compared to other cities in the United States, but we want to stay at that or lower the rate of suicide attempts. But it speaks of the health of our communities, despite the many challenges that our communities have, that our rates of suicide are pretty lower compared to other places in the country. So in my team, we do part of the work on suicide prevention from a mental health perspective.
Mm,
So at the Department of Behavioral Health, first of all, we work with communities and with community members and organizations. We also work across the city in partnership with the school district, with our teams at 988. We work with our colleagues who are doing diversity, equity, and inclusion, because where there is inequity and there is injustice, we see more suicidal behaviors. And we are in collaboration with many other programs who are helping community prevent suicide. I want to highlight the work that is critical in Philadelphia of network of neighbors. If you just Google network of neighbors, there is a phenomenal resource that is within our department that in
mhm,
crisis could be suicide or could be other crisis or
mhm.
preventing a crisis from
Yeah.
escalating. That's what we call very nerdy evidence-based practices,
Mm,
meaning the best possible intervention with trusted members in the community. So it's not people that helicopter inside and tell you what
exactly.
to do, but it's organically to help a community prevent or recover. And that's a suicide prevention intervention.
Network of neighbors is amazing. I worked very closely with Phil DeMario and the other community-based agencies when we were building that model, and that model was first born. And it was the whole purpose of it was communities healing communities instead of having someone outside come in. So yes, Network of Neighbors is amazing. I am a responder for Network of Neighbors, and I have been on many, many, many deployments with Yolanda. So, and she is amazing. So we've done amazing work in the city of Philadelphia. You were speaking about suicide and working with the Philadelphia School District. I remember hearing about this story, and when I tell you, it just broke my heart. There was a 10-year-old who went to Pennypacker School in the Northwest section of Philadelphia. And in the article, I remember reading what his mother said, that he came home and said he had the worst day ever in school. And that 10-year-old boy hung himself. I just can't imagine what he went through mentally for him to just say he had to end it all. Bullying it can do a number on someone. It doesn't always have to be physical, it could be mental. And what his mother went through, I just can't even imagine. So how do we, or what do we do to help, or what signs should we look for? You know what I'm saying? And when we're looking at our children, we're talking to our children. Okay, so I have two babies. I call them my babies. I have a 28-year-old. Look, he's married. Everybody knows I got my grandkids. Then I have my 30-year-old. They're my two babies. But I check on my children every day, quite a few times a day, and I always ask them, how are you doing mentally? In that type of situation where a mom, a dad, a grandparent, guardian sees that their child has been bullied and it just seems like they're not right, can 911 help in those types of situations?
We have another great resource. So it depends on the level of concern that you have, okay? And the 988 is a service for crisis. It's when things, you cannot handle them anymore, and the person going through the process cannot handle it anymore, okay? And you're concerned about their well-being. So 988, things are escalating in the house, like the fighting and the screaming and the kid making, concerning threats that they don't want to live anymore, that this life is horrible, that they don't trust anybody, that nobody cares about it. And the situation is escalating and they cannot calm down with any of the tools you have offered in the past or that had worked in the past. That's 988. Call them. They're going to give you tools, and fortunately, most cases are resolved just during conversation, okay? We have another fantastic resource in the city of Philadelphia that is open for all Philadelphians. We have a walk-in clinic, not an emergency room. This is a walk-in clinic for mental health services. So it's before the escalation, before the crisis, before we cannot sleep because we are so worried. This is a service that is the Meraki walk-in clinic, the mental health walk-in clinic that is in North Broad in the 3000 block. You can go there, just Google Meraki mental health walk-in clinic. You can go during business hours, and you're going to have a welcoming environment where you meet a mental health professional in a living room context. So they're going to sit with you, you're going to be comfortable, and maybe they are going to link you with services or are going to give you before the thing escalates. The other thing is that if you're starting to worry, you can go to Healthy Minds Philadelphia and check. We have there. Is it depression? What is happening here? You can also, if you have Medicaid, you can call to CVH Member Services. Okay? CVH Member Services. Google it. Call them. Say, I'm worried about this. And also, if your child is a minor, 18 or under, or 18 and still in high school, which is considered minor, call their pediatrician and say, I know that my child is being bullied. Also, call the school counselor. Go and talk. You were telling the story about your relationship with your babies. You know that the number one intervention that works for suicide prevention is having one person that cares about us and check on us.
Mm-hmm.
That's
Mm-hmm.
it. The number one prevention intervention that works is having somebody, one person that cares about us. It could be a peer, it could be an aunt, it could be a mom, it could be a grandmother, it could be a teacher. Somebody who checks on you. And when you say, I'm not doing well, follows up and says, tell me what's going on. And if you say something or you ask about suicide, it doesn't increase the risk for suicide. It actually lowers it. So asking for suicide does not push people into thinking more about killing themselves. It asks for help. Yes, this is the moment where you can connect with resources to help.
Now, what about those who suffer in silence?
Mm.
Like we may think they're okay when I say we, because again, there are, I'm sure there are people who have committed suicide and their family members did not even know this was coming. How do you look for signs for someone with that?
Yes, so we know that in general, people who die by suicide feel isolated and
Mm-hmm.
hopeless.
Mm,
And life challenges have overwhelmed their coping abilities.
mm,
The tools that they had to deal with life are completely overwhelmed. And that's why we see suicide at different moments of transition being a vulnerability. You know, that vulnerability moment where kids are transitioning from being a kid and they look like adults but still don't have the tools that allow you to function in the world like an adult. The coping skills are not there yet. That's a big moment of vulnerability for girls and boys. And it happens a lot too in older age. So those are two groups where changes happen very rapidly when we are aging sometimes
mhm,
and when we are teenagers. So that's the role of communities healing communities. If you have a neighbor, often older man, who is isolated, you all know what happens in our block, who never gets guests, who never visits anybody, who doesn't have a caseworker coming to the house, who has no relatives, who is isolated. Be you the person who rings the bell. Maybe they're grumpy, maybe they're cranky. Cultivate relationships. And when you're worried, call for resources. We can do that. We can be the healer in the community that contributes to our community's betterment. But the suffering in silence, that's why speaking about suicide is so important, because the silence comes from the stigma and the shame.
mm,
For many people, thinking about dying by suicide is a sin. So
mhm,
there is
mhm,
shame associated. So we need to eliminate stigma, normalize the conversation. It's Most people have moments of challenge in their life that they're going to have their spots. They
mhm.
deserve to be able to communicate. So reducing stigma, bringing it as a topic of conversation also reduces suicide.
Really quickly, how do we better educate law enforcement to deal with
Mm.
those who have mental illnesses?
Yes. That's a challenge around the country, and has a challenge also in Philadelphia. But we are making big step forward. Like, few people know that 988 is a collaboration between 911 and 988.
Mm,
So if you call 911 because in a crisis you were told to call 911 and you forgot about it, the operator will connect you with
mm,
988 immediately. And we are seeing different things that are happening, and more emphasis on the well-being and the emphasis. I think many of us are, because of generation and because of like being educated around the stigma in mental health, we have shifted from punitive models to justice models, and for shaming and doing punishment to rehabilitation and justice. So I think there are many people in our police department who have changed their shift. It's obviously very challenging, and it's particularly challenging when we think of the intersection of mental illness and substance abuse and poverty. Very challenging for many to exercise compassion.
Well, I want to thank you so much for having this very difficult conversation with me, but you gave some great, great information for the viewers. Thank you so much for joining me today. Thank you so much for joining me today. Very difficult conversation, but we received some great information that can be used every day, all day, no limitations. And I ask that you check on that person that you think is strong, that you check on that person that you think can handle any situation, because there are times when your loved ones are suffering in silence. Check on your children. We're living in a day and time where children who are going to school are faced with so many difficulties. Please check on your loved ones and make sure they are okay so that they can keep living to see another day. Peace and love.